How to choose a good toothpaste?
Is to just make sure that your toothpaste has fluoride, whitening agent in the toothpaste. Then there is a risk to your gums and your teeth.
3 months versus bristles splaying.
So if you are seeing bristles playing before 3 months, throw it out.
Normally we see brushing being done this way.
Teacher would demonstrate, right? You brush this way, but this kind of brushing is actually extremely bad for the teeth. One question we get a lot is, do I need to use mouthwash? Certain mouthwashes have alcohol in them. So what is the root canal? Are the best way to save a damaged tooth?
Does flossing increase the gap between teeth? Is there enough alcohol to fail a breath test?
No, probably not.
Welcome back to the Exposome Effect. I have with us today Dr. Varun Acharya, Maxillofacial Prosthodontist, to talk to us about all of the things that affect your teeth and how you can take better care of them. Doc, the first question I want to ask you is, what does a maxillofacial prosthodontist do, which is different from, or which is somewhere away from what a dentist does?
So dentistry is one of those fields which has actually 9 subspecialties, and in fact that is actually growing.
One life more and it almost becomes a cat.
Almost. Well, it's already a cat. It's 9 there, right? So now there is going to be added on 2-3 more subspecialties as new things are being discovered, such as, orofacial pain, dental implant, all these all getting added to the subspecialties. Prosthodontics is one of the original 9. And in prosthodontics, essentially what happens is we deal with reconstruction of complex defects in the mouth, in the oral cavity, and in general maxillofacial region. So when we say maxillofacial prosthodontist, it's someone who's gone into additional training for dealing with maxillofacial defects. So that could be even, like a nasal prosthesis, an auricular prosthesis, or nose or an ear for someone who may have lost it to trauma, who may have lost it to cancer, or intraoral prosthesis also. So like something like a denture, but for a cancer patient. So the denture has an extension because the patient has lost a part of the mouth due to cancer. Then the maxillofacial prosthodontist is specially trained for that. So that's what it is.
And generally, we usually go to one person who takes care of everything.
Sure.
How important is it for us? Because I know for sure in ophthalmology, you have to go to the different specialties.
Right.
Even within one visit, you are actually asked to meet multiple people. But in general, in dental practices, we usually see one person, of course.
Sure.
I've been to Acharya Dental, so I see multiple people depending on what concerns I have.
Right.
But is it quite common for one person to be administering everything? Or
yeah, I would say like as with every other field, dentistry has gotten more and more specialized. There are people who are general dentists who do fantastic work within the specialties. It's not that a general dentist is not allowed to do any of the specialty work. It's just that if you're a specialist, you've received additional training to do that work. So if a patient is walking into a general dentist's office, there's a fairly high chance that the general dentist would be the one administering that particular service, or they would probably have a specialist coming in to do that kind of service for that patient. If the patient is going into let's say an orthodontist's office, and the orthodontist owns that practice, then typically that practice would be geared more towards aligning the teeth, and there may be a small component of that which also renders the general dental services. So it's really how practices are laid out. Some practices like ours are multi-specialty. Some practices are purely focused only on, like for example, the gums, and they are a periodontal practice. They don't do anything else. Everything else is refer out. And then if it's a general dentist, typically the general dentist will bring someone in to render, whatever services are required, or refer out. It depends. It's also very kind of city based. Like in Mumbai, it's a lot of referral out.
mm-hmm.
In Chennai, people tend to have larger spaces, so you want to have So you want to have a multi-specialty type situation. So all permutations and combinations exist.
Let's start the discussion with toothpaste talk.
Sure.
What are the types of toothpaste that we have? What's a prescription toothpaste? What about the glitters in toothpaste? What about toothpaste that are extra strong, that are invigorating? Tell us everything about toothpaste. How to choose a good toothpaste?
Sure. So the first thing and the easiest thing for any adult out there, right, is to just make sure that your toothpaste has fluoride. I know that there is a lot of controversy. There's a lot of stuff you might see on social media. Oh, fluoride is bad for you. Anything in excess is bad for you. But all of your toothpastes are going to have the right amount of fluoride to prevent cavities. Fluoride is one of the most well-researched ingredients known to man, right? It is decades and decades of evidence showing how effective it is to prevent cavities and how safe it is. So it is an essential component in toothpaste. It is not something which you see a lot of companies come out now, oh, we have the super safe fluoride free toothpaste. And then you scroll down a little bit, they also have a fluoride version. So it's like, this doesn't make sense. What is your philosophy as a company? Why do you have both products, right? So it is absolutely safe in the correct dosage as prescribed by the various health bodies around the world. And that is something which is the first thing which you need to look for as an adult looking for toothpaste. Now, some people like whitening toothpaste. Okay, how much does it whiten? The problem is if you increase the amount of whitening agent in these toothpastes, then there is a risk to your gums and your teeth. Okay, if it's like a prescription level whitening toothpaste, like you would get in a dental office.
Do they work?
No, so that's the thing. So it's usually some form of peroxide which is used. And if it's a very high concentration, then you may end up burning yourself. So now that's not safe in a toothpaste which you buy from the store. So what ends up happening is they really dumb down that whitening agent. So it's not really so effective to begin with. Okay, because they have to make it safe. They have to say that it has a whitening agent, but then it's not really safe to begin with.
And they add a whole lot of agents like mint and any of the flavors, menthol, which actually increases the invigorating sensation, and then we think it's all whitening.
We think it's whitening, we think it's freshening. These are all like kind of subjective terms. How much this really does is very questionable. There are other toothpaste which came and went. Some, like there was a controversial ingredient like triclosan, which is no longer in toothpaste. There was a time when, you may even remember this, but there was these, the toothpastes were like essentially transparent.
Yes.
And they had little plastic particles inside it.
Yes, the
right?
microbeads.
The microbeads or whatever, and that was just plastic. That is straight up microplastic, which we might have ingested, if we had used that kind of toothpaste. And of course, it's ended up in the water supply as well. It's ended up in the sewage system. So these are things which are, my basic rule is, look for fluoride and look for any product which has been in the market for over 5 years. That's my goal.
What is with the 5 years?
If it has survived the market for 5 years and it's continuing for 5 years, you can be sure that this toothpaste is generally safe. Okay. I, in fact, look for longer. For me personally, I would probably look for something being in the market for 20 years. I'm like, because it's something which you're putting in the mouth, we're potentially ingesting it. This is something which safety is a very high sort of factor. So any new toothpaste which is in the market, I'm not interested to try it. I don't recommend it for my patients.
So the transparent ones with the glitters are gone?
They are gone. They are largely gone. There are some which still have the glitters, but they are soluble in water. So they are not a big deal anymore. But do they really do anything? Probably not.
And in any case, when does a toothbrush die?
So typically 3 months, unless you're like the Incredible Hulk and you're extremely aggressive with your toothbrush. But generally 3 months is what is the sort of timeline for a toothbrush. If you see that the bristles are kind of splaying out and fraying, it's time to toss that toothbrush.
3 months versus bristles splaying. Which would you choose?
Bristles splaying, throw it out.
Okay, so 3 months can go to 4 months or 5 months or 6 months if the bristles are splayed.
No, 3 months it's out, right?
So 3 months versus bristles, it's 3 months.
So if you are seeing bristles splaying before 3 months, throw it out. If you have reached the 3 months mark, throw it out.
Okay.
Yeah.
So it's minimum 3 months, maximum 3 months of a particular brush.
Exactly right.
And does the shape matter? The diamond shaped head. Then you have a flexible one.
You have a zigzag one. You have a flexible one. So generally the shape does matter, and you might think that the bigger headed toothbrushes are better because you're covering more area. But the problem is the way the mouth is designed and the muscles around the mouth are designed. If the brush head is too big, you're not going to be able to reach the far corners of the mouth. So you don't want to actually be too big. And the most sophisticated brushes out there are generally kind of medium to smallish size in what you would imagine a regular toothbrush would look like a standard toothbrush, right? Which is about an inch is what you would say would be the head of the brush. So something around maybe 30% less than that would be an ideal size. Yeah. Yes, something like that.
Okay.
That would be the ideal size so that you can get into the far corners of the mouth. That is what will help.
No correlation between the, like one phalanx, or no correlation between the phalanx of the thumb.
Not,
Nothing, to the size of the mouth, nothing like that.
no, not really. At least I haven't seen a study which does that. Yeah.
What about bristles? Soft bristles, hard bristles?
So hard, generally, we don't recommend for anyone.
But people say that they feel better because they've had that more aggressive brushing experience.
They have that more aggressive brushing. Potentially, they're also damaging a lot of their enamel. So hard is almost no one. Medium is for a few people who, at least in my practice, who I feel may be a little too gentle with the way they brush. Maybe I would say medium, but generally it's soft. Sometimes ultra soft if I feel they're going to be very aggressive. Yeah, so that's how I would recommend toothbrushes. So soft, ultra soft are the sort of workhorses. Medium in exceptionally rare cases. Hard is a no-no.
Normally, we see brushing being done this way,
Sure.
but I know that there is a different way to do it. So can you tell us about it?
Sure. So, it's always funny, like when we were in school, that's how the teacher would demonstrate, right? You brush this way. But this kind of brushing is actually extremely bad for the teeth, because what ends up happening is you tend to abrade the gums, or you tend to scrape away the gums in the wrong direction. Brushing is generally for the back teeth and the front teeth in a top-down motion. It can also be in a circular motion for the front teeth and a circular motion for the back teeth. So essentially holding your teeth edge to edge and going in circles with the brush. And then for the back of the front teeth and the back of the back teeth, the back of the front teeth, for the upper and lower, you would hold the brush vertically and go in a top-down motion. The only place where we can do that to and fro motion, which we are familiar with, is the biting surfaces of the teeth. And why is it safe on the biting surface? Is because there are no gums there. You can't injure the gums when you're brushing the biting surfaces of the teeth. And that's pretty much it. It's not rocket science, but it's really surprising how a lot of us have been taught the wrong way.
Doc, are electric toothbrushes actually better than manual ones?
So there was actually a study on this. So they had two groups of people, and they used, the electric for 1 week and then the manual for another week. I don't remember the duration, but essentially what came out of the study was, if you feel that you would do a better job of brushing your teeth with either a manual or an electric toothbrush, go for it. As long as you're brushing twice a day, that's fine. So no real difference between both, as long as the technique is appropriate.
And is there any age at which you can get children onto an electric toothbrush, or?
No specific guidelines, but I would say around 6-7 years, you do get toothbrushes made for about a 6-7-year-old, even younger actually, because it just has to be a small head, and the child shouldn't be scared, of course, with the electric toothbrush. But yeah, it's perfectly safe to use for kids as well.
It seems like an attractive way to get them to brush.
Maybe, depending on the child.
Of course. Another directional issue is also about how much toothpaste you need on your toothbrush. Aren't you supposed to go all the way down, or?
So this is very much actually age dependent, and also very much what is your toothpaste dependent, what does it have, right? Age dependent is, firstly, I said fluoride for adults, but I'm now going to go into a little bit more, where we don't want fluoride less than 2 years of age, okay? So less than 2 years of age, non-fluoridated toothpaste, and it's just a grain of rice, okay? And when do you start using toothpaste if you're talking about pediatric dentistry? We start using toothpaste when the first tooth erupts in the mouth, okay? Typically at around 1 year something is when this tooth would erupt, and before the tooth erupts, usually we are expected to just use a cloth, a warm cloth, and just wipe the gums clean, so that there's no milk residue or whatever could be on the gums. Once the tooth erupts, we move to toothpaste. We make sure that it's non-fluoridated up to 2 years of age, because it's very unlikely that the child knows how to spit this excess. It's going to be something sweet, they're going to swallow it, and we don't want to have an effect of systemic fluoride, for this kid. So up to 2 years, no fluoride, and it's always just a grain of rice. 2 to 6 years is age-appropriate fluoride toothpaste, and that is again just a grain of rice. 6 to 8 years is going to be a pea-sized amount, okay, and again age-appropriate fluoride. So your toothpaste will say 2 to 6 years, 6 to 8 years, so on and so forth. So age-appropriate toothpaste, which has the right amount of fluoride, pea-sized amount, and then you can do what your ads typically show you, which is like the ribbon length of toothpaste along the head of the brush. Now, that also has some restrictions. If it's a high fluoride toothpaste, then we only suggest a pea-sized amount. We do not want a full tube, like a full ribbon length of the entire brush. It's not needed. It's just going to be a pea-sized amount, and those are typically prescription toothpaste. It's not something which you buy over the counter.
Is there a way that the amount of toothpaste or the type of toothpaste changes as we grow much older? I'm talking about, say, when 50s and 60s, and people are having to have tooth troubles much more commonly.
So that's a good question. Sometimes, there are certain toothpastes which are specific for, let's say, sensitivity. And as we grow older, as there is wear and tear of the enamel, you would see that teeth patients start reporting that they have sensitivity. And that is something where we may need to prescribe an anti-sensitive toothpaste. And so that is a potential thing where you may see change over time. But generally, it wouldn't surprise me if someone has used the same toothpaste for the past 40 years and they're perfectly fine, and they're going to use it for another 40 years. It's fine.
Is there a case to do fluoride testing? Is it something that you come across from using too much, too high a strength?
So there is no real requirement if you're buying store-bought toothpaste. There is no real requirement to go into any kind of fluoride testing, right? If there is excess fluoride during the development phase, so essentially when you're a child and the water has excess fluoride, then you would have a condition called fluorosis where you would see the teeth having a sort of appearance which is kind of a patchy brownish kind of appearance, and that is called fluorosis. And that is something which cosmetic dentistry typically resolves. So something like veneers or crowns is what would typically be needed to make those smiles look beautiful, because they typically are very sort of brownish, spotty looking teeth. If there is even more fluoride for an adult and they continue to ingest very high fluoride in the water, then there is something called skeletal fluorosis, extremely rare, it's almost not seen, but the tooth fluorosis is seen when there is too much fluoride. Getting this from a toothpaste is also incredibly rare. It's only because it's in the water supply.
Now that you've spoken about toothpaste, what are the other things that we're supposed to use but we aren't really aware of?
So toothpaste, toothbrush is the essential, right? Now there are the other, sort of ancillary things which also come into play. One question we get a lot is, do I need to use mouthwash? Okay. Mouthwash, actually the evidence shows us the effectiveness of mouthwash to reduce cavities is minimal at best. Okay, what is really helpful is toothbrushing, toothpaste, and using dental floss, which I'm going to come to. But mouthwash itself doesn't really do a good job. So
Makes you feel good though.
Makes you feel good, temporary effect. And then you have to be very careful with mouthwash. Certain mouthwashes have alcohol in them. So if you have alcohol in the mouthwash, there is the immediate effect of like bacterial killing as soon as the mouthwash is done. But then there is drying of the mouth, which happens immediately after because it's alcohol.
And is there enough alcohol to fail a breath test?
No, probably not. Probably not, because the effect is so transient that the bacteria recolonize almost immediately in the mouth, and because the mouth is now dry thanks to the alcohol, now we have actually more bacteria, and that's a problem. And that's why you see a lot of alcohol-free mouthwashes. And so if you are the type who says, I really want to have this constant feeling of like a fresh breath, then alcohol-free mouthwash, sure, you can do it. Is it really improving your oral hygiene or making anything better for you? Again, questionable. There is one category of mouthwash, typically chlorhexidine, which we prescribe after surgery, which helps in healing, has antibacterial properties, helps prevent a wound infection essentially. But even this one, strictly, we tell our patients, you can use it for 2 weeks. Beyond 2 weeks, you have to stop. It's not for the family. It's not a general purpose mouthwash, because beyond 2 weeks, it starts to really stain the teeth. Okay, so that's mouthwash. Next, we can move on to dental floss. Okay, so dental floss is actually fantastic because it's the only thing we have which can really effectively clean between teeth. Your toothbrush cleans, all the surfaces which are exposed, but between the teeth is the only thing, only dental floss can get to it. Now, the challenge is a lot of people struggle with it, right? Because it is difficult, it requires a fair amount of dexterity. You get some of those flosses which have like a holder, and some people like that. Those flosses are typically thicker. It's not something we really recommend.
But they're also single-use plastic.
Yeah, single-use plastic as well, bad for, the environment. So then the other alternative is, of course, water flossers. Okay, so water flossers essentially are battery operated, and they have a little tank and they shoot high speed water between the teeth. The studies are a little bit inconclusive. Are they as effective as floss? I would say probably not.
How
Okay.
much less are we talking about? If it's 100%, what is if
I can't give you that number because the studies also have a lot of bias in them, in terms of who was the sponsor of the studies, what was essentially the origin story of that study, who's funding it. Okay. And when you start looking so deep into it, then you start to question it. But I have found it useful for patients who don't have enough dexterity. This could be older people. This could just be people who could never figure out how to use a floss like in the back of the mouth. Like these water flosses are fantastic to just flush food out. And I in fact recommended this to someone, a very senior surgeon, and who was struggling with the floss. And the problem is people don't exactly know how to use floss, and they're a little rough, and they end up traumatizing the gums every time they use the floss. And then they say, oh, I'm in pain every time I use the floss, and there's bleeding, and so and so. And then we switched over to the water flosser, and that made a world of difference. So
I'm one of these people. I think every time I floss, there is a lot of drama going on because I invariably have sometimes bleeding, a lot of pain afterwards. I think I could be doing something wrong. And then you put me on to a water floss a while ago.
Right.
What really appealed to me was the fact that it is much more eco-friendly.
Yeah.
Dental floss, and considering the size of the population, and if we are going to make it a habit, I know that at least it's about 3% of people who floss out of every 100 people that brush.
Right.
I'm not sure if
Probably lower in India.
Probably, yeah.
Yeah.
And then if all of us were to get onto what is essentially a very good habit,
Yeah.
then the amount of floss that goes out, and
Yeah.
it's not really biodegradable.
It's not really, yeah.
It's
It's
again
also
bits of
coated.
plastic.
Yeah, it's coated with wax and stuff, and yeah, it's not really. And
Is there a biodegradable floss at this point?
there are kind of flosses which are not waxed, so they kind of sort of decouple or de-entangle a little easier. But whether they're really biodegradable, I've honestly not looked at it. I can't give you a straight answer for that.
So then I saw this idea of a water floss which really lasts long, and then there is hardly, of course, you will have to set it up initially and you have to buy it initially. That's
But it lasts probably 5 years.
Yeah.
Like a one water floss will probably last you 5 years.
And there's
Yeah.
and there's hardly any ecological footprint
Yeah.
from that habit. And I thought that's a brilliant idea.
Yeah, it's really a game changer for certain types of situations. I'm not saying that a water floss should replace everyone who's flossing. I'm not saying it's better than flossing, but I'm saying that it has its applications, especially in these certain situations where flossing may be injurious or you're not able to do it.
Even if they find out it's like maybe 50% effective, I'm happy to do 2 sessions of water floss to 1 session of the regular floss,
yeah.
just so it is more eco-safe. The other question that we had in this was about other dental appliances we have, which are not, I wouldn't call them dental appliances, but stuff that's trending. Basically, massagers, gum massagers, automated gum massagers and stuff. What are your thoughts?
Not really. A proper brushing technique should be enough to stimulate the gums. You don't need a separate device to do this. So, yeah.
And more of us are biting our teeth, grinding our teeth at night.
Yeah.
And I'm one of them again. And I was given a night guard, a bite guard.
Sure.
Does this become regular use for most people? Does it become something that you regularly recommend for most people? Or is it only for us who are champion bruxers?
So, there was a lot of questions in the past of why bruxing happened. And, for many of the things in medicine which we don't have an answer for, stress, right? You just said stress and, that was to blame. But then everyone is stressed. And why is it that some people brux and some people don't brux? So then one of the things which has recently been coming in is sleep apnea.
It's still stress, doc. Some people stress others, some people stress
True.
themselves.
Of course.
Yes.
Of course. But a thing which is happening now is sleep apnea is now sort of on front and foremost when we talk about bruxing. Because what happens is the theory at least is the airway cuts off. So this is someone who may be snoring or have actual sleep apnea. The airway cuts off when they sleep because they typically have a thick neck. And because they're not getting that oxygen, the brain sends a signal to the lower jaw, which moves. The rest of your skull is fixed, but the lower jaw moves to kind of thrash around to try and get more oxygen in. And that is the bruxing. And the bruxing or the grinding, right? So the grinding is also linked to people who have acidity. So people who typically complain of bloating and heartburn and all of these kinds of things also very frequently we see that they also have grinding as well. And the theory for that is as they have acid reflux, the acid comes to the mouth, it stimulates saliva production, and then they start grinding while they're asleep. And the problem with grinding at night, the amount of forces they generate is significantly more than what they could generate even like just sitting down and fully awake. So typically, let's say a woman would do about maximum of about 500 newtons of force. When they're bruxing, they can go maybe even 2x that. So this is something which is extremely damaging to their natural teeth and to anything artificial we put in the mouth as well.
So would you say that with more of us, and it's also something that's increasing over a period of time, especially with, again, stressful lifestyle, plus also, again, acidity.
And certain medications as well, yeah.
And therefore, would a night guard or a bite guard be a recommendation for everybody?
So, no, not really.
It's not preventative at all?
It is absolutely not preventative. Night guard will only act to cushion the teeth so that if you're bruxing, the damage is like a shock absorber. The damage is on the night guard, it is not on your teeth, right? So your teeth live to fight another day, and the night guard gets damaged, maybe in a year you have to make a new night guard. What would be, well, treating the cause of sleep apnea is we now make devices which essentially when people wear it, their jaw is moved forward slightly by maybe about half a centimeter, and this opens up the airway, and so they don't snore. So the spouse is typically very happy because they're not snoring anymore, and they also have less of the grinding motion. So that's something which we do a lot nowadays. For the very extreme cases of sleep apnea, they need to get a CPAP machine, a continuous positive airway pressure machine, which is, it's a little box, I'm sure you know, and there's a mask and everything. There's a whole process involved with that. But for the not so severe sleep apnea patients, we are able to help them with these devices.
The thing about the CPAP machines are that they're so cumbersome, people usually end up dropping off.
Right.
But the ones that persist do see a lot of improvement, is what I'm told.
Exactly. Yeah.
Plus, again, people who work on lifestyle, obesity, all of that also helps a little bit.
Absolutely.
The bite guard is very useful, but it's very difficult to get used to it initially.
Yeah. Some people find it very difficult. Some people, in about 3 days, they're sorted. Yeah.
Is it okay to use home hacks like Soft for instead of a mouthwash? Is it okay to use anything that's mint leaves? Is that better than a mouthwash?
So, as I had already said, the mouthwash itself, in terms of effectiveness, is questionable. Okay, it gives you this feeling of freshness. Probably the only home remedy for a toothache would be clove, right? Because clove, it kind of works like from your gate control theory, which is an irritant, and therefore you have pain relief. But nothing is going to give you long-lasting pain relief, and nothing is going to fix the problem besides going to a dentist and getting the actual problem sorted out. So yeah, there are not many home hacks. The other question that keeps coming up is oil pulling. And I know some influencers recommend it, saying that it's fantastic. So, we as dentists are struggling to get people to brush twice a day and floss. Asking them to pull oil between their teeth for 15 minutes is, firstly, sounds like an insurmountable task. Secondly, if they're doing it and they're not paying attention to what they're doing, which is very likely over the span of 15 minutes, there is a chance that they can also aspirate and they can cause an oil emphysema. And so this is why throughout the evidence, right, it's you may find some evidence saying that oil pulling is effective, but the quality of those journals and the sample size, the number of participants involved were very, very small. There is no broad consensus statement saying that oil pulling is going to be good for you. We would rather you just brush twice a day and floss. Like, that would just be the best way to keep the dentist away.
So no oil pulling that replaces brushing?
No oil pulling for anything.
We spoke about toothpaste, toothbrushes, we spoke about floss. We missed to speak about tongue scrapers.
Sure.
What are your thoughts?
Tongue scrapers actually do have a role, okay? And why tongue scraping is important is because if a person has bad breath, right? One of the potential areas where this bad breath is coming from is the coating of the tongue, okay? So tongue scrapers are useful to do that. But again, we shouldn't be too aggressive with the scraping, so much so that we are injuring the tissues of the tongue. The papilla of the tongue is what it's called. We shouldn't be doing that. But typically, you get these stainless steel or copper tongue scrapers. Sometimes it's in the back of the brush as well. Any of it is fine. You can even use the brush itself as long as you're getting that food coating off of the tongue. Okay. If bad breath is not an issue, is there some huge benefit of tongue scraping? Again, questionable. And the funny thing about bad breath is people always think it's because of something in the mouth. Bad breath usually originates in the stomach.
Now, can you tell me about why bad breath is becoming such a big problem?
Bad breath is a problem. It is a growing problem. And if you really look at it, it's to do with the lifestyle of people these days, right? They are skipping meals, they're sleeping late. All of these things play a role because this triggers acidity. And acidity is actually the leading cause of halitosis, which is the scientific term for bad breath. It's not so much things happening in the mouth. Okay, people always assume that, oh, there's maybe a cavity in the mouth, or there's some food stuck in the mouth, and that's why I have bad breath. Very rarely is the origin of bad breath the mouth itself. It's usually from the gastrointestinal tract, from the stomach acids. So if lifestyle is regulated, right, if there is proper sleep schedules and proper meal schedules, then we would see much less of bad breath being a problem. Of course, it can be a mouth origin. This is when you have a patient who has a very large cavity where food is going and sitting in there, and it's just stale. After a couple of days it starts to smell. That is a possibility, of course, but it's very rarely the sole cause. And if you're asking me why it looks like it's suddenly becoming endemic, then the reason is simply acidity.
And now that we spoke about a bad tooth,
Mm-hmm.
we've spoken about how to take care of it on an everyday basis.
Sure.
Tell me about, when does a tooth go bad? What is a bad tooth?
Right.
Where does it start?
Broadly, there are two things. One is if you have bacteria in the mouth, and now we see this mostly, especially in those people who do not brush their teeth at night. What happens is the saliva, there's no more saliva. You have a dry mouth when you sleep because saliva secretion stops. The food, the dinner which we just ate, remains in the mouth. It's stuck between the teeth. It's stuck on the surfaces of the teeth. And the bacteria process that food, produce acids, and make holes in the teeth. That is what you would call a cavity. Okay? So cavity is a destructive process of the tooth by the bacteria making holes in the teeth and eventually leading to what would be called a root canal, because the cavity has gone so deep that it's now touched the nerve of the tooth. And then finally, the root canal also can spread through the bone and through the rest of the body. The infection in the root canal can spread. It can become a systemic infection in very severe cases. So this is one sort of pathway for a bad tooth. How does it happen? The second pathway is gum disease. So you have patients who, let's say, are smokers or they are diabetics. These patients are typically where we would see more gum disease. So the tooth itself is not just held in by the bone, it is held in by a ligament. There's a little kind of hammock around the root of the tooth which encases it in the bone, and then there's the gums. So if you have gum disease, all of that kind of starts loosening up, and now your teeth start to move. Okay, so that is another way where people would term as a bad teeth or a bad tooth, and that's because those teeth will need to be extracted if that gum disease is very severe. So those are the two main sort of reasons, besides developmental anomalies and congenital defects and all of that stuff. The two main everyday problems are gum disease and cavities.
And when does a bad tooth go really bad in the way that you have to remove it?
Really, if you look at all through, and a lot of people have different opinions on this, but if you look at all through our literature, our dental literature, essentially when a tooth shakes a lot, okay, we have grades of mobility, we call it. So we have grade 1, grade 2, grade 3. When something is very severely mobile, and I'm simplifying it a lot, of course, but when something is very severely mobile, then it's generally considered that tooth cannot be saved. Okay, and that is when that tooth would have to go and be extracted. Maybe it's replaced by a bridge, maybe it's replaced by a denture, or maybe even an implant. But that is usually the condition where you have to extract the tooth. Now, you may have a tooth that's perfectly firm, but there's nothing left of it because it was lost. 80% of that tooth was lost to cavities, but it's still firm. Doesn't mean we can save it. Even those teeth we may have to end up removing, because saving it is just going to be heroic dentistry which may last for a month and it's going to break again. So
not worth the effort.
Not worth the effort, yeah.
And if you were to say, considering all of the controversies going around root canal, if you were to say that this probably has changed the way dentistry has improved or has become more important, would you say that root canal was a big deal for to move from having to knock off the teeth, but to do more of a protect and preserve kind of an approach?
Yeah, so root canal, so what is the root canal, right? So we spoke about the tooth. It has the enamel on the outside, there's dentine, which is on the inside, and then the nerves of the teeth. And that branches out into the canals which go in the roots, okay? So if you have a cavity which is very deep and is touching those nerves, then we do something called a root canal treatment. So the canals are cleaned out and we put an inert rubber kind of material, it's called gutta percha. We fill that up and we close it up. This is the most conservative way to save a tooth which has a severe deep cavity. Okay. Now recently there's been controversy because there's been like random documentaries which are not based on any scientific literature, just some guy's claims saying that root canals are bad for you, they cause XYZ problems. This is absolutely unfounded and untrue. Root canals are the best way to save a damaged tooth. And for that reason also these documentaries have been banned, because there's so much misinformation about the actual procedure. So once we do a root canal, typically we need to also cap those teeth. We need to cap those teeth to protect them. It all depends on the amount of damage that tooth has undergone, but they need to be capped, especially for a back tooth. Yeah, but that's basically about it. The root canals are one of the most conservative ways to save a tooth which is heavily cavitated.
What if a tooth did not have cavities but just broke off?
Yes.
What if I had a fall and the tooth flew off my skull, or the tooth flew off my jaw?
Right.
What happens then?
So it depends on where it broke and did it break at all. So sometimes you could have a fall and the entire tooth comes out in one piece. Then in those cases, the advice we give is to actually place it in cold milk.
Why?
So that actually preserves that periodontium around the tooth. Okay, it's going to help the tooth remain vital.
So say if a tooth comes off after trauma, I'll have to place it in cold milk right away?
Directly in cold milk, run to the dentist. So now at this point, the dentist is going to want to re-implant the tooth, because the longer you wait, the socket which the tooth used to be in also starts closing up. So that makes it more difficult for the dentist to put it back. So the sooner you get there, the better. And we would reintroduce that tooth. In some cases, in many cases, these teeth are typically root canal treated, because the nerves have been cut as this tooth comes out. So that's root canal treated. If there is color change over time, it may need a cap as well, because the sudden damage to this tooth pops the blood vessels that permeates through the teeth, and then these teeth start looking orange or red or brown.
Given all of this, would you say it's worth putting it in milk and going to the dentist?
Absolutely. There is no replacement for a natural tooth. Okay, the natural tooth is the best thing. With the enamel and the dentine and the nerves and all of that stuff, it is the best thing. We have not found a suitable replacement for a natural tooth. And some people may be pushing dental implants, saying that they are suitable replacements for natural teeth. I always say dental implants are replacements for missing teeth, but they are not replacements for teeth. Okay, because there is this trend out there where a lot of aggressive work is being done and perfectly good teeth are being removed and replaced by implants, saying that, oh, it's an implant, you won't get cavities, you'll not have any issues. But implants have their own issues, which need to be tackled with. They need to be understood. So as much as possible, we delay the placement of an implant. We want you to continue with your natural teeth for as long as possible, and then we move on to implants if absolutely necessary.
So in most movies, Doc, you see this transformation when somebody looks not so great initially and then transforms to something fantastic. Initially, they show this person as having braces, crooked teeth, glasses, and then you have maybe a slightly large nose, and then they have undergone cosmetic surgery, they have replaced with contact lenses, and then they've had Invisalign. Tell us what they've had.
So what we're talking about is many different ways to align teeth, right? So it all started with first your traditional metallic braces, and you won't believe what's the actual word which they use for those metallic braces. Like when dentists want to communicate to understand what metallic braces is, they say, yeah, you've seen it in school, right? Those train tracks. So that's a train track braces.
Train track and rubber bands.
Train track and rubber bands. And to make it attractive, we would say, you can have different colors of the elastics around the train track. Kids were excited because everyone else in their class also had braces. Then they moved on to ceramic braces, which, are not so visible. You don't see them from far, but they're still kind of visible if you come close because there's still a wire running through. Okay. Then things evolved. Now there are something called lingual braces. Lingual braces are braces on the inside. And there are a group of people I would never do lingual braces for. And if you want to guess what that is, a singer. Because lingual braces, if they have brackets behind the teeth, that interferes with speech. It may take about 2 weeks to get used to it, but for someone who's a professional singer, that may not be,
It would
a time
change
frame.
the way that they eventually evolve.
They may develop a lisp also for a short period of time. And a singer may not be so enthused or comfortable about that. So then we moved on to Invisalign or aligners, right? So these are basically, they look like trays. And how it works is a patient's teeth are scanned and it's sent to a computer simulation. And the computer simulation says, okay, your teeth are now like this. And at the end of your aligner treatment, your teeth are going to look like this. And after, let's say, 30 aligners, your teeth are going to look like this. So what the computer just did now, it is simulating the position of your teeth as it is now. And it is saying, okay, step by step, every aligner is going to move your teeth just a little bit to our final goal, which is this, which is your perfect smile. So anything to do with moving teeth has to happen gradually, or you end up risking the teeth itself. You risk losing the teeth itself if you are too aggressive with the force. And which is why you have these trays, which are now generated by the computer. They are 3D printed. They're cut into shape, and a box is given to the patient which has, let's say, 20 aligners or 30 aligners depending on their particular treatment, and they wear aligner number 1 for about 10 to 14 days. Then they wear aligner number 2 for 10 to 14 days, and every time they change that aligner, their teeth are moving a little by little to that end goal.
Maybe I have a dumb doubt here, but Doc, aren't we going to have teeth movement all our life? So do we ever get done with a 30 tray set, or do we keep doing it?
So that's a fantastic question, because this is a core principle in orthodontics, which is the science of aligning teeth: retention. So once you move teeth into the desired location, teeth unfortunately have a bad habit of going back to where they came from. Okay, so they have a memory. And because of that memory, we develop ways to retain these teeth. Sometimes the retention is by giving something that looks like an aligner to be worn first for 24 hours and then only at night, and then maybe at alternate days. It all depends on where that patient started from. For some patients, the chance of relapse is so high that they would actually have a thin little wire on the back of the front 6 teeth to hold that in place. Okay, and typically the bite is what will hold the back teeth in place, so we don't put a wire for the back teeth, but the front 6 teeth definitely need that wire to hold it in place. You asked me a question saying that growth is a continuous process. As the jaw grows, the teeth also change position along with it, and it's a very gradual change, so it's not something that is really noticeable over time for most people. So that is not really an issue. But that immediate relapse from completion of treatment, going back to where they came from, you can imagine a patient who's completed 2 years of orthodontic treatment, whether braces, ceramic, metal, lingual, aligners, whatever. They're finished, they're so excited, and they go, and like 3 months later, they're back to where they started. So this is why retention is discussed very, very early on at the start of treatment itself, saying that once we finish, we're going to have to hold things in place. Otherwise, it's going to bounce back to where you came from.
And is it really required that you go up and meet a dentist to have all of this done? It looks like a chronic process. It looks like something that I will have to do, or someone will have to do all our lives, so to speak, if we want to keep our teeth in the best positions. We have a number of startups that talk about doing it yourself at home. While this has been fantastic for dermatology, that we've had a lot more skincare that is being taken seriously, being done at home. How much of DIY is possible in dentistry, especially from a point of view of how good are these aligners?
So I'll come back to what you had originally said, saying it's a chronic process. Once the teeth are aligned and they're held in place, you don't need constant maintenance.
Not even if you have a bone resorption with old age?
Yeah, but you're not going to go back into aligners at that point. You would look at alternate treatments. You may look at gum treatments. You may look at bone grafting. You may look at something else, but you're not probably going to go back into aligners at that point because the teeth are in the appropriate location. Okay. Now, for the DIY question, there are a lot of companies that came up, and the best way to tell you how sustainable this market is, there is a company in the US which is now they're bankrupt. Okay, the company exists no more, but it was, you could walk into like a grocery store, and there was a little kiosk, and you take the scanner, and you scan your own teeth, whatever best you can do, and send it out to the company, and they will prepare your treatment plan, align your teeth virtually, and send you a bunch of trays. But the problem was a lot of the other issues in these teeth were not getting diagnosed. So, for example, if someone walks in and wants their teeth aligned, but they have 5 cavities, we're not going to align their teeth first. We're going to solve the disease process first and then deal with the alignment. So that is something that got missed in this DIY solutions. And I think that problem still exists in India as well. The DIY solutions still exist. How much they have disrupted the market. They came in with this whole sort of energy that they're going to disrupt the market and it's going to be, change everything. And so far, it's not been like that. I would say most orthodontists and other specialties who are practicing some form of alignment are still seeing patients walk in the door all day, every day, and we're not really losing out to these DIY solutions. And I do not recommend those DIY solutions.
I see the same thing happening. We were talking about ophthalmology in an earlier episode. And then the idea of going and getting glasses prescribed wherever, it's a matter of convenience. However, that's not the only thing that's happening to the eye.
Right.
There's a regular checkup that's required. For dermatology, it's almost like about 90% of sustained care depends upon self-care habits. Sustained improvement depends upon self-care habits. So it's kind of a happy place where there's a significant bit that's being done at home.
Yeah.
And a small proportion that is being offered as treatments. Say, for example, in conditions where it's device-based. So, but I see that because dentistry primarily is it's a surgical field at the end of the day. So then it requires that somebody actually checks all of the, almost the overall holistic health and then prescribes what's required. Or do you see this coming back with better technology? Do you see this DIY actually becoming a tool for more people? Because the reach is more. The impact is more.
Unlikely until they have a proper diagnosis. So let's say they figured out a way to do a proper diagnosis involving a dentist at the patient's home or the office, wherever they want to be scanned for their aligners, the DIY solutions we were talking about. If they could do a proper diagnosis and deal with all of the pathology that exists in the mouth, then DIY solution maybe.
Or maybe partner with more dentists to have this initial scan.
I think that's an approach which they are taking, this particular company. As far as I know, I haven't looked into it too closely. But yeah, that product already exists. Yeah, it already exists. So
yeah, let's talk about some common myths. Does flossing increase the gap between teeth?
No, it does not. But I can very easily see why someone might perceive that flossing has increased the gap between teeth. So imagine you have 2 teeth which have a little gap, maybe the size of a business card between them. If food goes and sits between those 2 teeth and it's kind of locked in there, yes, it's causing inflammation, yes, it's causing bone loss because of its presence over there, but no further food is getting in because that existing parcel of food, I don't want to call it a parcel, it sounds huge, but that existing little bit of food has blocked that contact or that opening. And so now once you floss, you've cleared that food out, and now it feels like there's a gap between teeth. So the gap came in mainly because of the lack of flossing. There may have been a cavity which is developed, which is a hole between the teeth. So this is something which I can understand why people say that flossing causes gaps between teeth, but it truly does not. It actually will, in the long run, prevent gaps between teeth.
So neem sticks are back in fashion right now. What is your thought? Do they work? Are we supposed to get back on them?
Neem sticks probably have some amount of antibacterial effect. However, the mode of application is less than ideal. You may end up causing a lot of injury, a lot of damage to the gums. The same reason we don't recommend anyone use toothpicks, because toothpicks are dangerous. You could end up stabbing the gingiva, the gums,
I didn't
and
know
causing a
toothpicks were
problem.
not recommended.
Toothpicks are not recommended.
So how do you get the chicken bit off?
You would want to floss or use a water floss, but not a toothpick. Yeah.
That is news. It's almost like a courtesy that's offered
Yes. Yeah.
after a meal.
After a meal, yes.
Yeah, yeah.
But you need to be careful. So a lot of people come to us with toothpick-related injuries. Yeah. The other dangerous thing in a restaurant is actually fish bone. We see this a lot, like fish bone, just a tiny little spicule stuck in between the gums, and they're brushing and they're flossing and they just can't get it out. But the angle is so challenging that it can only be removed by
Have you
a
had
dentist.
any challenging case around this?
I have. A good friend of mine actually came in maybe about a year or two ago with a fish bone stuck. And he's like, Doc, I'm in so much pain. I think you'll have to remove my tooth and this and that. And we look at it and it's just this little piece which you take out and then he's totally fine.
I know that almost everybody who's in private practice is essentially an entrepreneur.
Correct.
Even dermatology, dentistry. But in here we call it practice management.
Yes.
And you have a special course for it.
That's true, yes.
And why was it important?
So what we realized, and this was with the conversation I had with a friend, and our dental practice now, Acharya Dental now in November becomes 51 years old.
51 years
51 years old. And my mother, who started the practice, Dr. Acharya, she continues to practice, fortunately for me. So what we realized is dental school teaches us how to do dentistry. How what my mother would like to say, especially for this, is how to drill, fill, but they didn't teach us how to bill. Okay, this is actually an issue in terms of we are all small business owners. We run a practice which has employees. We have the same taxes to pay. We have consumables to purchase. There's stores, there's supplies, there's inventory, there's all of these things which we have received absolutely no training for. If we have not received training for any of this, how is it that we could be expected to be competent in any of this?
Exactly. It becomes a suboptimal management, even when you have an extremely optimized delivery of a particular skill.
Right.
How the skill gets utilized becomes very suboptimal.
Exactly.
So you end up wasting what you learn without knowing what's the best way to put it into use for a larger good or for a higher impact.
Right. Essentially, it becomes firefighting on a day-to-day basis. So when we started conducting these courses, we took surveys of the people attending our courses. And none of these people had an issue with the delivery of dentistry, right? The dental skill was not their issue. They did not have a problem saying, oh, I don't know how to do this filling or make this crown or do good work or whatever. Their issue was, oh, my staff are always arguing with each other.
Yeah.
Oh, they are always late. Oh, how do I deal with incentives? How do I deal with increments? So those things became very interesting questions for us. And because we have learned the hard way over time, that is something which we felt that we could give back to the community by doing this course. And we're proud to say we have done now 15 batches of our practice management course.
And the numbers served?
And every batch now is about 40 to 50 people.
Wow.
So yeah, we've been doing it now for about 3 years.
Fantastic.
Thank you.
And the new clinic and the new center is an offshoot.
Yes. So what we decided, or rather what we realized over time, was we really enjoy teaching. Both my mother and I really enjoy teaching. And the facilities available for teaching always have something missing, right? Usually these places would skimp on the AV, like the hotels which we would go to, right? The projector is not great, the sound is causing a lot of static. Some things are not just perfect, right? So, and we wanted to create this perfect environment for teaching. It's not necessarily confined to dentistry. Of course, we have a simulation lab where, we teach. We don't teach anyone before they finish dental school. They have to finish dental school, but once they finish dental school, they're eligible to take up our courses, and we essentially do like an upskilling or a skill refinement to get them to be better dentists. And that's kind of what we enjoy doing, and that's why we decided to start Acharya Foundation.
The place is great. I might do some of our practice management sessions over
Fantastic.
there.
You're more than welcome.
Let's see. Thank you so much, Doc, for joining me today. And I think we discussed a lot of things dentistry. We went all over the place. But I hope it will be very useful for folks following along. Thank you for coming.
Thank you for inviting me. And it's not surprising because dentistry is all over the place. It's such a vast field. So I'm glad that we got a hit on certain key topics. Thank you so much for having me here. It's been an absolute pleasure.
And thank you for joining us. And if you have questions on this topic, drop them in the comments and we'll discuss. I'll see you soon and you take care.